Any mind-boggling issue about health, let's get interactive.
Indeed, I may not have exhausted the questions on your mind, because I don't have access to that. But I'm sure you have something to ask of the panelists today. Now, the doors are opened for you to ask questions, or even there's a contribution you have, or suggestion. So everyone within the delegates assembled here, you have access to ask questions of the panelists, or if there's a suggestion you want to make. Thank you. And so, please, let somebody have the mic.
Yes, please.
You mention your name.
Kindly help us out.
Mention your name and where you are coming from, and then your question or contribution. And we have the person's hand up.
Help me out.
Thank you very much. I'm Dr. Ismail Ibrahim from Muslim Health Workers Association of Ghana. Yeah, Doc, you did ask a question or you said something in relation to herbal medicine. I want to ask, if you look at, let me say, the world or Ghana per se, there are two types of healthcare systems that we practice here. That is the orthodox and alternative. And as you said, we mentioned about a problem. So why can't you be, let me say, a collaboration? At least we have these quack doctors, okay, in the system, especially at the herbal side. What are you going to do, at least, so that you can fish out these people, so that it will help? Because within all, not all of them are bad. Others are doing a good job, but it's only few who are becoming problematic. So what are you going to do, at least, so that at least those people can be fished out, so that at least those who are doing the good work also could be motivated, so that they also help, so that we can have universal health coverage. Thank you very much.
Thank you. So you are calling for regulation of herbal medicine in Ghana, am I right?
Exactly.
Thank you. Can anybody take it from here, please? How do you regulate to fish out the fake ones?
Okay, fishing out the fake one. Anyway, let me just say my own side of the review. We wrote an article, and this idea was coming from the fact that the bone setters in Nigeria, they are very popular. And either we like it or yes, the people find it very easy to go to them. They are very accessible, and they know all the protocols in the hospitals and all those things. And I must also say that if they get it right, particularly if it's the closed fracture, they are all healed faster than the one in the hospital. Yes, because I don't know where they get their name from.
Bone setters are able to heal the patient faster?
That's what I put in the condition there. If it is a closed fracture and it's not very complicated, very simple fracture, they are all, maybe because of the strength of their leaves and all those things, heal faster. But it becomes a problem when it's a compound fracture. Compound fracture means the fracture that is accompanied with open wounds and all those things, because they may not be able to take care of it. So they have their strength, they have their weakness. And of course, the barrier is always how to integrate the traditional, healing into the orthodox one. For instance, if you break leg, you go to traditional healing. The first thing they will do, one system, is to break a foul leg, knowing fully well that no fowl will die through breaking of leg. So you are so sure that, first of all, you will not die. So as the foul leg is healing, your own fracture too is healing. Okay? So it's a very big problem how to integrate this. So we recommend make some recommendations. One of these is inviting a neutral body who are neither orthodox practitioner nor traditional practitioner, practitioner, to midwife this integration. Because for orthodox, we write it down, we prove it. In the other case, incantation, we don't know. Ordinary incantation can do a lot. How do you mix some of this together? But I quite agree that there's a need for integration.
So probably, do we look at setting up a regulatory council for herbal medicine? And
Yeah,
Dr. Nyama, you want to say something?
Yeah.
Oh, there's one now. I like that. Okay, Amy. Oh, you have somebody who is going to help us here. Thank you, sir. Your name and where you're coming from, sir. Can somebody? Okay. Well, I get overwhelmed with the numbers I see from morning to evening on TV. Thank you, sir. Your name and where you're coming from, sir.
My name is Dr. Pastor. I'm acting that technical coordination.
Thank you and welcome, sir.
I'm traditional medicine council. That regulates traditional medicine practices. We have traditional medicine directive. And as integration is ongoing. If you go to many of the Ghana service facilities, now traditional medicine also in the same compound practices. So if you go there, you pick wherever you want to go. But as you know, in many institutions, you always have, the past. And that's what all of us will come together and fight this cancer. Because you can sit in Accra and somebody can be practicing, somebody will be in Accra. You can't let somebody doing the wrong thing. You want the policeman to do an arrest. Nobody wants to report so that they call you a bad person. Okay. So as I have the mic to let me also give my comment.
Yes, sir.
You know, if you look at Ghana, I would say we are blessed. I've worked in the health system for over 30 years. When I qualified as a doctor, we had few driving nurses. Now we have university training driving nurses. There was no physiotherapy training. We had driving physiotherapy. We have driving lab science. We have the college. So over the years, the federal government has done really well. What we need to do is maybe how to move the hard workers and other people to the rural areas. But it's not only ministry of health. As somebody was saying, we need access to the place, roads, schools. If we put the health workers to the village, the first thing will be school for my kids. We have the people, but how to move them. And what we also don't proud ourselves, you know, we have Ghana was one of the first African countries to have national health insurance. Even though it has challenges, it has made a lot of impact in our health. So we haven't reached there, but I must say, we are on the road to achieving some of this universal health coverage. And if we want to talk about universal health coverage in Africa, and we grant countries, then Ghana will be among the first 10 who achieve universal health coverage in Africa. Because we have a lot of this one part ongoing. Recently, I'm not going for that. This agenda 111 is work. I mean, we are on the road to improving access. We are training more specialists. So by and by, we are achieving that. But you know, challenges will always be there, and that's why we are having this digital health alliance. Also, one of them, the private sector is coming on board. So yes, we are achieving, and we want all hands on deck. Thank you very much.
Question of you. Maybe you can take your seat and speak. You said Agenda 111. These are facilities built across the country. But today, as we speak, Ghana faces a drain on its health workforce. People are running to the UK and the US in numbers. The thing is, our salaries are not enough. We are not incentivized and we are not motivated. How is the ministry going to ensure that there will be adequate workforce within the Agenda 111?
You know, yet you know what? I've worked in the US, I've worked in India, I've worked in China. If you go to US now, US doctors are moving to Australia. If you go to UK, UK doctors are moving to US. If we Africans are moving to UK, South Africa. So that migration will never stop. Migration will never stop. But when you come to Ghana, how many, you know, 50 years ago, we have only University of Ghana. Now we have 5 public hospitals and then 2 private hospitals. We have nursing training schools across the country. The challenge, you know, the economy is what is also preventing. We have, up to speak, we have about 50,000 nurses registered with nursing and midwifery council that have done in this country. We have some doctors who don't have financial clearance. So if we now find to employ all these people, I think we can fix most of our Africans. So we are hoping if the economy improves, some of these challenges will be solved.
Thank you. Let's give it up to the doctor. Anyone or contribution? There's somebody here.
All right, thank you very much. I am John Ozugata. I work with CSR Stepbury and a PhD student at School of Public Health. Let me start with the traditional herbal medicine stuff. I think we are putting all in one basket. As of now, when you go to tech, there are medical doctors, traditional medical doctors being trained there. And they have established a very authentic institution by which, before they even treat you, you go through the lab system and everything, and which they are really, really doing well. And even some genuine medical doctors, sometimes in certain situations, they can transfer you there. You understand? I think the situation has to do with the regulation, the implementation of policies, and how we can integrate them. With the incantation people, they are totally different. So let's look at the authentic ones that are doing well, encourage them, and put the necessary policy in place and implement them so that they can also play their role. Now we are talking about universal health coverage, and these are key people that I think they can also help in order for us to access health. Aside that, there is a key question you asked concerning key challenges with the physiotherapy. And I think when he was about to answer, there was some interaction. So if you can mention some key challenges that the physiotherapy sector faces, I'll be very glad.
So to you, Professor Ballo, can we have a mic for you, please? Key challenges.
Okay, so key challenges, insufficient training institution, lack of human resources, because of all the three, University of Ghana is the foremost. The qualified physiotherapists, we are not more than 5. And it's a department that's supposed to have at least 15, not more than 5. Not to even talk of the other universities. So another thing is poor pay in the country. The moment they are out, they are out of the country. Like he said, nobody can stop that. Migration is natural. I'm also in Ghana. I'm a Nigerian. I'm in Ghana. It's migration. So you can't stop that. Again, another key one which we have been able to find solution to now, which will soon start, is the graduate program. Okay, so we have just been given go ahead by the Ghana GTEC to go ahead, and by the grace of God, we are starting this academic session. By the time we are able to roll out that, I'm sure most of this problem will be out of, because some of the other universities, tech doesn't have people, who also are struggling, it's only university that I can see a little bit, stable, so these are some of the key, and in terms of practice, whatever applies to all other healthcare practitioners also apply, to physiotherapists in terms of challenges. Okay, so and it's lopsided as well. Most of the physiotherapists are found, Kumasi, Accra, maybe Cape Coast, Takrady, all those places I'm mentioning. There are about 3 or 4 in those hospitals. For Kolebu can boast about 30, am I lying? 30. Kofanoche about 10. Okay, so you see that it's lopsided. So, and so also is the services to people. We are all Ghanaians. So why should some people be having and the others are not having? And then one important thing again, my senior, mentioned it, the issue of unemployment because of a lot of financial burden on the government. They are doing a lot. Even the national health scheme, they are one financing it. That is not so in a developed country. Governments have a lot of responsibilities they are bearing at the same time. Even the employment in the US and all those places they are going, it's not the government that is employing people that are going there. It's a private sector. So, but government will still fall back on them. Have they made enough enabling environment for people to even establish private clinic? Pharmaceutical materials and equipment are very expensive. Import duties at the port. How do you settle that if you want to establish one? So this problem are general, not peculiar to us, but for physiotherapists, insufficient training institution, human resources are solved, and then they lopsided, services. And I also want to forget about other rehabilitation services. These speech therapists, I'm not sure they are up to 20 in the whole country. I'm not sure. And you can imagine the importance of speech therapists. Children who will not speak, they will pick them up. People, adults who have stroke, some of them have aphasia, speech problem and all of that. Is their work. Nobody can do it. They are the ones, doctors cannot do it. That is their own work. Audiologists and all those things. All those, it's not physiotherapists alone in the rehabilitation. There are a whole lot of people, occupational therapists. There are a whole lot of rehabilitation science that are there. So all the challenges applies to them.
Thank you. I think all of us are eager to ask a question, but let me take my last question from you, madam. And I'll take your questions on paper later. Please, let's go.
Yeah, mine is a contribution. I think doctor has said much, and then the other gentleman too. So I'm a medical phytotherapist by profession. I practice herbal medicine for more than 15 years now. And then I was also trained at Kean University. So as he said, there's an institution that is training. Then the regulatory body is the Traditional Medicine Practice Council. As of 2011, there was a policy to integrate herbal medicine in Ghana Health Service facilities. So that has also been running. We have about 52 now, including police hospital, my own facility. And so I believe that this forum needs a little bit of enlightenment at that aspect. So we have socio-cultural dimensions of health. No matter where you find yourself, here in Ghana, there's a traditional aspect. It is part of our culture. So there are people who will always prefer traditional medicine. So with the regulation, there's a practice and then the premises, which the council is actually working very hard on. Then the product is regulated by Food and Drugs Authority. So if the person goes through FDA and they have that approval to advertise their product, then they come onto the television, it's all about money. And then the radio and then the TV, they also need their money, then they play their adverts. So we are doing a lot of advocacy because we are professionals. We have been trained and gone through about 6 years of training. So we know what is actually wrong with you when you come. We give a diagnosis and then we prescribe the appropriate herbal medicine. And so about 52 all around the country. Each region has at least 3. Greater Accra has about 9. Police Hospital, Legma is there, Gan West, Gan East, Gan North, Tema Polyclinic has, Tema General has. So we're all around. So if the person prefers traditional medicine or herbal medicine for that option, I believe that alternative is there. Yeah.
Thank you. So I was going to ask a question, but time will not allow me. I saw a TV advert. A woman seated nicely, and now what do you say to those people? But we'll come to that later. Some of the adverts, I think, traditional medicine should make sure you stop it right now. Thank you so much. MC, back to you.
It has been very interactive. We thank you. If you have further questions, suggestions, recommendations, you can send it to our website.